Hey there, iPrevent viewers! July is BIPOC Mental Health Awareness Month. With everything going on right now, we definitely wanted to cover this topic. The Awareness Month first started in 2008 in honor of B.B. Moore Campbell, who is an American author, journalist, teacher, and mental health advocate who worked tirelessly to shed light on the mental health needs of the Black community and other underrepresented communities. Initially, the observance was referred to then as Minority Mental Health Awareness Month. However, there has been a move away from the previous term minority, as the rhetoric was othering and a microaggression. Instead, now the person-first terminology BIPOC is used. BIPOC stands for Black, Indigenous, and People of Color. It is the preferred term moving forward over previous terms like minority. The BIPOC community faces many disadvantages that are not seen in the white population, especially when it comes to mental health. Black adults are 20% more likely to report serious psychological distress than white adults. Their rate of depression are lower, but they are more likely to have chronic problems and serious consequences. They are also more likely to experience PTSD. To learn more about PTSD, check out our podcast on SoundCloud, as this is a specific topic we recently covered. Despite these numbers, though, one study showed that 63% of Black Americans believe that a mental health condition is a personal sign of weakness. They are also far less likely to receive treatment. For example, one study showed that 90% of those with a substance use disorder in the Black community over the age of 12 were not getting treatment. It is estimated that 1 in 5 members of the Latinx community is experiencing mental illness symptoms, but only 10% of them will seek treatment. This is in large part due to the lack of access to healthcare. Asian Americans are 3 times less likely to seek mental health treatment compared to the white population. Arab Americans remain one of the most understudied populations when it comes to health in America. It is guessed, though, that they are also marginalized like the rest of the BIPOC community. Native and Indigenous American adults have the highest reported rate of mental illnesses in any single race identifying group. They also have the highest rates of suicide attempts and substance use disorders. So it is obvious that the BIPOC community is less likely to have access to healthcare or have accessible mental health professionals. Why is this? It could be due to a lack of insurance or underinsurance, the fact that mental health stigma is often greater among BIPOC populations, a lack of diversity among mental health care providers. Only 6.2% of psychologists, 5.6% of advanced practice psychiatric nurses, 12.6% of social workers, and 21.3% of psychiatrists are members of the BIPOC community, which in turn means there is a lack of culturally competent providers. There are language barriers. There's also a distrust in the healthcare system in general. That is why it is so important to find a medical professional that works for you. If you are a member of the BIPOC community, when looking for a provider, ask your options if they have had cultural competency or linguistic training. Research shows that a lack of cultural competence in mental health care can often lead to misdiagnosis and inadequate treatment. I also want to clarify that these disparities are not due to genetic predispositions for mental health. This is a result of systemic racism and generational trauma. Help your part to dismantle these inherent problems in our society by getting active in your community. Fill out the 2020 census, vote, reach out to your representatives, and make yourself heard. If you or someone you know needs treatment for a substance use disorder, iPrevent is here to help. Call 504-418-4955 to get enrolled with our detox and or short-term residential program. If you have any questions, please reach out to us on our website or via social media at iPrevent_OHL. Until next time.